Reverse heart plaque naturally. Somewhere in the last year or two, you probably heard a number you didn't expect. Maybe it was from your doctor after a routine scan. Maybe it was a cholesterol number on a blood test that looked higher than it used to. Or maybe it was just a passing comment. There's some plaque buildup, nothing urgent, but let's keep an eye on it. And ever since, that phrase has been sitting quietly in the back of your mind. I want to start today by telling you something honest, because this topic gets more misinformation thrown at it than almost any other health topic I cover on this channel. There is real, genuine science showing that plaque in your arteries is not a one-way street. It can be slowed, it can be stabilized, and in a meaningful number of cases, it can shrink. That's not a marketing claim. That's backed by real cardiology research going back decades. But I also want to be straight with you about what that actually looks like in practice, because a lot of what you'll find online promises dramatic reversal from a supplement or a juice cleanse, and that's simply not how your arteries work. Today I'm going to walk you through what genuinely helps, what the actual research shows, and how to build a realistic doctor-supported plan that gives your arteries the best possible chance to heal. I'm Coco, and this channel exists to help people over 60 feel confident and comfortable in their own bodies, with real, honest information, no gimmicks, no fear tactics. Let's get into it. What plaque actually is and why reverse is a tricky word. I want to spend a few minutes here because understanding what's actually happening inside your arteries changes how you think about every single fix we talk about today. Plaque is a buildup that forms inside the walls of your arteries, made up mainly of cholesterol, fatty deposits, calcium, and inflammatory cells, all embedded within the artery wall itself, not just floating loosely inside the blood vessel like debris in a pipe. That distinction matters because a lot of the popular language around this, flushing out plaque, cleaning your arteries like a drain, isn't really how the biology works. And misunderstanding that is exactly what leads people toward products that promise something they can't deliver. What the actual research shows is more nuanced and, honestly, more encouraging than the dramatic before and after claims you'll see online. With aggressive, sustained changes, particularly very low intake of saturated fat, consistent exercise, and in many cases, cholesterol-lowering medication working alongside those lifestyle changes. Imaging studies have shown measurable shrinkage of plaque in a meaningful percentage of patients, along with a change in the plaque's composition that makes it considerably more stable and less likely to rupture, which is the event that actually causes heart attacks. For a lot of people, though, especially without medication involved, the realistic outcome from lifestyle changes alone is that plaque stops growing or grows much more slowly than it would have otherwise, and existing plaque becomes safer, denser, and more stable rather than shrinking dramatically. Here's my honest take on why this distinction matters so much. If a video promises you can melt away decades of plaque in 6 weeks with a specific tea or supplement, I want you to be skeptical of that immediately, not because reversal is impossible, but because real reversal takes sustained, comprehensive effort, often over many months to years, and it works best in partnership with your doctor, not instead of them. What we're covering today is the real version of that story, the one with actual research behind it. And honestly, it's still genuinely hopeful news. Your arteries are living tissue, not concrete, and they respond to how you treat them, just not on a 6-week infomercial timeline. The supplement trap. Before we get into what actually works, I need to be direct about something because I think it will save some of you real money and, more importantly, real disappointment. Walk into almost any pharmacy or search reverse plaque naturally online, and you'll find an enormous market of supplements promising exactly that. Specific enzyme blends, exotic extracts, arterial cleanse formulas with price tags that would make your eyes widen. Some of these contain ingredients that have a small amount of legitimate research behind them in narrow contexts, which we'll get to. But the overwhelming majority of the dramatic claims on these labels are not supported by the kind of solid, repeated clinical evidence that would make a cardiologist comfortable recommending them as your primary strategy. And a few have actually raised safety concerns when taken in the high doses these products often use, particularly around interactions with blood thinners and blood pressure medications that a lot of people over 65 are already taking. I'm not telling you every supplement is worthless, and I'll mention a couple later that do have real research behind them in a supporting role. What I am telling you is that no pill, however well marketed, replaces the handful of changes that the actual research consistently points to as the real drivers of plaque stability and regression. Those changes aren't flashy, they don't fit neatly on a bottle label, and that's exactly why they don't get marketed the way supplements do. But they're the real story, and that's where we're headed for the rest of this video. The single biggest lever: what's actually on your fork. If I could get everyone watching this to focus on exactly one category of change, it would be this one, because across every major study on plaque regression, diet consistently shows the largest, most consistent effect of anything we'll discuss today. The clearest, best documented approach comes from research on very low saturated fat, whole food, plant-forward eating patterns, the kind of diet studied in some of the most well-known plaque reversal research over the past several decades. The common thread across that research isn't some exotic superfood. It's simply a dramatic reduction in saturated fat from red meat, full-fat dairy, and fried food, paired with a sharp increase in fiber from vegetables, legumes, whole grains, and fruit. That combination does two things at once. It lowers LDL cholesterol, often significantly, which is the primary driver of new plaque formation, and the fiber itself binds to cholesterol in the digestive tract and helps remove it from the body before it ever reaches your bloodstream. You don't need to go to an extreme overnight to get real benefit here, and I want to be clear about that, because I know that level of dietary change can feel overwhelming, especially after 65, when your habits are decades deep. Even a meaningful shift, more legumes and vegetables at dinner, red meat down to an occasional rather than daily food, swapping butter and full-fat dairy for olive oil where you can, produces real, measurable improvement in cholesterol numbers within weeks and sustained improvement in artery health over months. Fiber deserves its own specific mention because the research on it is remarkably strong and consistent. Soluble fiber, specifically, the kind found in oats, beans, lentils, apples, and psyllium husk, has been shown repeatedly to lower LDL cholesterol meaningfully when eaten consistently, often in the range of 5 to 10% with as little as a bowl of oatmeal a day sustained over a couple of months. That might not sound dramatic, but a sustained 5 to 10% LDL reduction, purely from oatmeal, compounded over years, is a genuinely significant contributor to slowing or stabilizing plaque growth. Omega-3 fatty acids, found in fatty fish like salmon, sardines, and mackerel, and in smaller amounts in walnuts and flaxseed, have real research behind them for reducing inflammation within the artery wall itself. Which matters, because inflammation is a major part of what makes plaque unstable and prone to the kind of rupture that causes heart attacks. 2 servings of fatty fish a week is the amount most consistently associated with benefit in the research. And if fish isn't part of your regular diet, a conversation with your doctor about a fish oil supplement is reasonable, since dosing and quality matter more than people expect. And I do want to mention 2 of the supplements that actually have decent research behind them, since I was critical of the category as a whole earlier, and I think it's only fair to be specific. Plant sterols and stanols, found naturally in small amounts in vegetables and nuts, but available in concentrated form in certain fortified foods and supplements, have solid research showing they can lower LDL cholesterol by blocking its absorption in the gut when taken consistently at the studied dose. And psyllium husk, which I mentioned a moment ago as a fiber source, works essentially the same way whether you get it from food or from a simple supplement, and either is a reasonable, low-risk way to add soluble fiber if your diet doesn't naturally include much of it. movement and why it matters more than people think. Diet gets most of the attention in this conversation, but exercise plays a genuinely distinct and important role, one that works through a slightly different mechanism than diet does, which is exactly why the two together produce better results than either alone. Regular aerobic activity, the kind that gets your heart rate up meaningfully, walking briskly, swimming, cycling, dancing, has been shown consistently to raise HDL cholesterol, often called the good cholesterol, because it actually helps carry excess cholesterol away from artery walls and back to the liver for removal from the body. This is a genuinely different mechanism than lowering LDL through diet, which is why exercise and diet changes together tend to outperform either approach on its own in the research. The amount that shows real benefit isn't extreme. Most of the research showing meaningful improvement in cholesterol profiles and artery health points to about 150 minutes of moderate activity a week, which breaks down to something as manageable as a 30-minute brisk walk 5 days a week. If you're starting from a fairly sedentary place, and a lot of people are after 65, especially if joint pain or past injuries have made exercise harder over the years, starting with even 10 minutes a day and building gradually produces real measurable benefit. And consistency matters far more here than intensity. There's also growing research specifically on resistance training, the kind involving light weights or resistance bands, showing benefits for blood pressure and overall cardiovascular markers that are somewhat independent of the aerobic benefits we just discussed, which is why a combination of both, most days involving some walking, 2 or 3 days a week including light resistance work, tends to show the best overall results in studies looking at heart health broadly. I want to say something directly to anyone watching this who has a heart condition already, is recovering from a cardiac event, or simply hasn't exercised regularly in years. Please talk to your doctor before starting or significantly increasing an exercise routine, not to discourage you, but because they can help you find the right starting intensity for your specific situation, and in many cases can point you toward a cardiac rehabilitation or supervised exercise program specifically designed for exactly this purpose, which takes a lot of the guesswork and worry out of getting started safely. The 2 habits that do the most damage. I'd be doing you a disservice if I only talked about additions and didn't address the 2 habits that the research consistently shows do the most harm to artery health, because addressing these often matters more than anything else on this list. Smoking damages the inner lining of your arteries directly, making them considerably more prone to plaque buildup and, critically, making existing plaque less stable and more likely to rupture, which is the actual mechanical cause of most heart attacks. Here's the genuinely hopeful part of this particular fact, though. The research on quitting smoking at any age shows that cardiovascular risk begins dropping within weeks, not years, and continues improving substantially over the following 1 to 2 years. It is never too late for this particular change to matter. And if you've tried to quit before and it didn't stick, that's common. Most people who successfully quit for good have tried more than once. And your doctor can point you towards support and, in many cases, medication that makes this specific change considerably more manageable than trying to do it purely on willpower. Chronic, poorly managed high blood pressure is the second major factor, because sustained high pressure against artery walls directly damages the same inner lining that smoking damages, accelerating plaque formation and making existing plaque more unstable over time. If you've been told your blood pressure runs high, consistent management, whether through the lifestyle changes we're discussing today, medication, or usually both together, is one of the single most impactful things you can do for your arteries specifically, separate from cholesterol entirely. Stress and sleep deserve an honest mention here too, since they connect to both of the factors above more than people realize. Chronic, unmanaged stress raises blood pressure and inflammation levels over time, and poor sleep, particularly undiagnosed sleep apnea, which becomes considerably more common after 65, does the same thing through a slightly different pathway. If you snore heavily, wake up frequently through the night, or feel unusually tired despite a full night in bed, that's worth mentioning to your doctor specifically in the context of heart health, not just as a sleep issue on its own, since treating sleep apnea has real, documented benefits for blood pressure and cardiovascular risk. A story worth hearing. Let me make this concrete with a real example, because I think it shows exactly what realistic progress actually looks like, without overselling it. A man in his late 60s, I'll call him Robert, came to me about 8 months after a doctor's visit where a scan showed moderate plaque buildup in one of his coronary arteries. He was frightened, understandably, and had spent a few weeks before we talked, reading everything he could find online, including several supplement websites promising dramatic reversal within a month or two. We talked through what the actual research supported, and Robert made a real decision to commit to it properly rather than looking for a shortcut. He worked with his doctor, who adjusted his statin dose slightly and confirmed it was the right foundation to build on, rather than something to avoid in favor of lifestyle changes alone. Alongside that, he cut red meat down to roughly once a week, added a daily serving of oats and a daily serving of beans or lentils, started walking 30 minutes most mornings with his wife, and quit smoking with the help of a program his doctor recommended, something he'd tried and struggled with twice before over the years. At his 1-year follow-up scan, his plaque hadn't dramatically vanished, and I want to be honest about that because that's the realistic story for most people. But it had stabilized completely, showed no further growth, and his cardiologist specifically noted that its composition looked more stable and calcified than it had the year before, which is exactly the kind of change that meaningfully reduces heart attack risk even without the plaque shrinking away entirely. His cholesterol numbers had improved substantially, and just as importantly, he told me he felt considerably better day to day, more energy, better sleep, and genuine pride in having finally quit smoking for good. I share Robert's story because I think it's a far more honest and, frankly, more encouraging picture than the dramatic transformation promises you'll find elsewhere. Real progress here is steady, it's measurable, and it adds up to something that genuinely matters for how long and how well you live. Working with your doctor, not around them. I want to spend a moment on something important because I think it gets lost in a lot of natural health content, not just on this topic, but broadly. If you've been prescribed a statin or another cholesterol or blood pressure medication, please don't stop it in favor of lifestyle changes alone without talking to your doctor first, however good your intentions. The strongest research we have on plaque regression, the kind showing real, measurable shrinkage rather than just stabilization, almost always involves lifestyle changes working alongside medication, not replacing it, and statins in particular have decades of solid research behind their role in stabilizing plaque and reducing heart attack risk specifically. Lifestyle changes and medication aren't competing approaches, they're partners, and the best outcomes in the research consistently come from combining them rather than choosing one over the other. If you have concerns about a medication's side effects, or you're wondering whether your dose could be adjusted as your lifestyle improves, that's a completely reasonable, worthwhile conversation to have directly with your doctor, and often one they're glad to have, since a patient making genuine lifestyle changes gives them real options to work with. What I'd gently caution against is making that decision unilaterally based on something you read online, however well-intentioned the source, simply because the stakes here are genuinely high, and your doctor has access to your specific numbers, your specific risk factors, and your specific history in a way no general video, including this one, ever can. It's also worth asking your doctor about periodic imaging or blood work to actually track your progress over time, a repeat cholesterol panel, or in some cases a follow-up scan if one was done previously. Having real numbers to watch move in the right direction over months is genuinely motivating, and it turns this from an abstract hope into something concrete you can actually see improving. Your realistic action plan. Let's put this together into something you can actually start today, because I promised you practical steps, not just information, and I want this to feel achievable rather than overwhelming. This week, if you haven't already, schedule a conversation with your doctor specifically about your cardiovascular risk, current cholesterol numbers, blood pressure, and whether any imaging or additional testing makes sense for your situation, so you have a real baseline to work from rather than guessing. Add 1 serving of soluble fiber to your day, a bowl of oatmeal, a cup of beans or lentils in a soup or salad, and keep it consistent rather than occasional, since the research shows benefit builds with sustained daily intake over weeks and months. Aim for 2 servings of fatty fish this week, salmon, sardines, or mackerel. And if that's genuinely hard to work into your routine, ask your doctor about a fish oil supplement and the right dose for you specifically. Start or continue a 30-minute walk most days. And if that feels like too much right now, start with 10 minutes and add a little more each week, since consistency matters far more than starting at full intensity. If you smoke, take the first real step this week, a conversation with your doctor about quitting support, even if you've tried before. Every attempt makes the next one more likely to succeed, and the cardiovascular benefit of quitting begins within weeks, at any age. And cut back on saturated fat where it's easiest for you specifically. This might mean red meat, full-fat dairy, or fried food, whichever is the biggest piece of your current diet. And swap in olive oil, vegetables, and legumes where you reasonably can, building the change gradually rather than trying to overhaul everything on day one. Closing thoughts. Here's what I want you to walk away with today. Plaque in your arteries is not a life sentence, and the science genuinely supports real hope here. Slowed growth, meaningful stabilization, and for many people, real measurable improvement in artery health, especially when lifestyle changes work alongside your doctor's guidance rather than instead of it. What it isn't is a quick fix from a bottle promising results in 6 weeks. The real version of this story is steadier, more honest, and frankly more sustainable, small, consistent changes to your plate, your daily movement, and the habits that do the most damage, sustained over months and years, exactly the way Robert's story played out. Start with the fiber and the walk. Those 2 alone move the needle meaningfully. Add the rest as you're ready, work closely with your doctor throughout, and trust that your body, at any age, still responds to how you treat it. If this video gave you something you can actually use starting today, that's exactly what Anderson Coco Aging Consultant is here for. Subscribe if you'd like more honest, practical videos like this one. And if you've made changes of your own that have genuinely helped your heart health, share them in the comments below. I read every single one, and some of the best advice on this channel has come directly from people just like you. Take care of that heart. It's carried you this far, and a few real steady changes are all it takes to help it carry you further. I'll see you in the next video.